I treated her for 5 minutes, contacting the right pubic bone with a vertical force applied for 5 minutes. And now we have symmetry at the top of the pubic joint, and I can now take up the slack. I see her body move, I see her head move, so the force is going through that joint, and I can spring it, and I see her head bobbing up and down. So we've restored vertical mobility of the right pubic bone. I mobilized the ilium. I got my hand under her sit bone, and then my hand on top, and I just created a force couple, and then I oscillated that 10 times. Then I had her hug her knee outside of her right shoulder, about a 20-degree angle. She did that for 2 minutes. Then I had her lie on the side, and I treated the left side butt. Right now she has improved symmetry. It's not symmetrical. It's improved. So I think your pelvis developed asymmetrically, but the important thing is that now we have normal motion translation. We have normal spring mobility through the right pelvis. And let's have you lie on your right side, facing me. So then, to restore motion of the ilium on the left side, I pulled on the iliac shelf, and then I pushed through her thigh. Can you check that camera angle, Josh, and just see if we have this? Okay, so I created a force couple, pulling constantly with my elbow extended, pushing into her thigh, and then I just oscillated that 10 times. Go ahead and line your stomach. And that restored improved positioning of the pelvis. And now we have forward rotation on the left. We have restored inferior glide on the right. We have restored superior glide on this side. And the sacrotuberous ligament I can now indent. And the sacrospinous I can now indent on this side. So we have improved the ligamentous tone. I then put 2 pillows under her stomach. And I put 1 pillow under her ankle to relax her hamstrings. And then I just captured the sacrum, and I just pushed it inferiorly for 5 minutes. And now I can take up the slack inferiorly. I can spring it, and I see your heels bobbing. So the force is going through the SI into the hips, knees, and ankles. And now I'm going to test backward bending. And now I can take up the slack on the sacrum. And now I can spring it. So now there's force translation. So now the sacrum has inferior glide motion, and it has backward bending motion as well. So I will stop filming here. She might come back tomorrow with a different pattern. We've done a lot of input into all the mechanoreceptors of the joint, so all the muscles are fairly relaxed. But it is possible that she might come back with both ilia being stuck forward. Call that a bilateral anterior ilium, or just call it an anterior tilt of the pelvis. And that's treatable. It won't surprise me if you present with that tomorrow. Because between now and then, you're going to, turn in your bed when you go to sleep and put different forces through the pelvis. You're going to sit in the restaurant, you're going to walk, you're going to get all kinds of forces going through it. And if there's a deeper pattern, that's going to emerge. Okay? I also mobilized the first rib. I'm not going to show how I did that. I have other video on first rib mobilization. And tell me how you felt walking, and tell me how you felt sitting.
Good. Very good.
Could you tell something was different?
Not really.
So it would take maybe forward bending for you to tell?
Yeah.
You want to step down and forward bend?
Yeah. There's no pull.
Nice. Very good. I see a smile.
Yes.
All right. Well, thank you very much.
Thank you.